Today on the Perry channel, I'm going to be covering all things endometriosis in menopause. Our first question is, what is endometriosis? Endometriosis is an often painful pelvic disorder in which tissue that normally lines the uterus is found elsewhere in the pelvis. Specifically, this tissue attaches to the organs, the fallopian tubes, or even skeletal muscular tissue in that region, and it can be super painful when it bleeds. So much like the uterus bleeds during your menstrual period, this tissue, because it is very similar to the tissue lining your uterus, also bleeds. However, unlike the tissue that's in your uterus, this tissue has nowhere to go when it bleeds, so it builds up in your pelvis and it can be super painful. So what are the symptoms of endometriosis? Endometriosis is usually described as super painful, especially during your menstrual period. Women often describe pain when they're having sex or having a bowel movement as well. Other symptoms of endometriosis include infertility, fatigue, nausea, vomiting, diarrhea, and constipation, as well as they also remark that they may have excessive bleeding issues during their periods. So to answer your burning question, if you have endometriosis and you're nearly in menopause, you may be wondering, is menopause going to cure my endometriosis? The answer is maybe. It's not yes or no. It's not black or white, unfortunately, right? So here's what's up. Many women report that their symptoms of endometriosis get much better once they go into menopause. However, some women still have some mild cramping or even some more severe abdominal pain. Here's what's happening. So even though estrogen levels have fallen to a very low level, that little bit that your ovaries are still producing is enough to trigger some of that endometrial-like tissue to bleed and slough off every month. Again, it has nowhere to go, and so it's staying in your pelvis, causing all of that pain and discomfort. So if menopause does not relieve your endometriosis symptoms, your doctor may recommend that you try an over-the-counter pain reliever such as Aleve or ibuprofen. If this doesn't work, your doctor may also recommend trying hormone therapies such as oral contraceptives, or there's a couple different types of hormonal therapy that is geared just for women after menopause. If those therapies do not work, your doctor may try conservative surgery, and what that means is they may try to go in and remove that tissue that's aggravating you. If that doesn't work, usually women try hysterectomy. Hysterectomy is when a physician removes your uterus, and it can be partial or complete. And so sometimes they will go as far as taking the ovaries and the fallopian tubes. It really depends on the extent of the disease. As always, if you are suffering from endometriosis at any stage in your life, make sure to reach out to your doctor. Your doctor can provide a comprehensive plan that is tailored specifically to your needs. Thank you so much for joining me today on the Perry channel.